So hi, I'm Dr. Nikita Vizniak, and today I'm with the amazing
Therese Westcott.
yeah. So we've got a couple of interesting findings here with Therese. First of all, what I would like to do is go through your history a little bit. So what brought you into the clinic here?
I have really bad back pain that I've always had for probably quite a few years now.
And we'll just go down. We'll go down that avenue a little bit right here. So the back pain that you actually have, what is it from? Like, what do you do for a living?
I'm a hairdresser.
Okay.
So yeah.
Can you show our viewers what this? Because we'll post this up on YouTube here. Can you show our viewers what your hand motion actually looks like?
Okay. So normally when I'm doing hair, I'm normally
just wait. I need a clip. I need a clip right here.
Okay.
Pretend like it's really long. Okay?
So I'd be bringing my hands obviously above my shoulders here.
Yeah. So you spend most of the day with your arms up high like
yes.
this. Okay.
And always kind of curved in.
Yes, and always always rounded forward in the shoulders a little bit. Okay.
Yeah.
All right. And what do you notice for symptoms when you're hairdressing?
Well, I definitely notice I have a tight pain here, and I can, especially when I put my arms above my shoulders, then it is like a tingling numbness from my elbow down.
Okay, and is that just on the one side or both sides?
Just on the one side.
So there's a couple of interesting things there that we can look at. The next thing was that kind of struck me when we did our first initial interview was how many people have you seen about the issues that you're facing right now?
Too many.
Okay.
Yeah, hundreds, yeah.
Okay, yeah.
And it is very frustrating because I always complain about the back pain and no one has said anything. No one has even said how bad my posture is.
Okay, the other thing that struck me though was you said when we did this previous exam the other day, you said that no one had actually palpated your arm.
No.
Okay, what about palpation of your back?
Well, they'll feel my back, but I feel like that's just how a chiropractor would figure out where to crack and stuff.
Yeah.
But no, they've never checked my arms, felt anything like that.
And just so we're clear, how many people have you seen, would you say? Like you've been in for brain scans, MRIs, CTs,
I've done
all this?
brain scans,
MRIs, X-rays, neck X-rays.
Too much stuff.
Okay.
And I've seen a lot of
So let's just be clear. Cardiologists, chiropractors, physical therapists, massage therapists.
Yeah, I even went down to the States to get a brain scan.
Yeah.
Yeah.
Okay. And again, just to stress this, people have palpated your back lightly and no one's gone down your arm or anything like that.
No.
Okay. So just for any of our viewers that are watching this, I would strongly encourage you guys to follow the HIPNURS protocol: history, inspection, palpation, motion, neurovascular screening, referred pain, and then special tests. You can avoid missing things or making key recommendations that can offer a larger benefit for your patients. And we'll do a separate video on that here later on. We'll put the link down below, but let's focus on this case right here. So when you first came in, what were some of the things that we did to start with that no other practitioner had done?
Well, you lifted my arms above 90 degrees, which was very interesting, actually.
You mean let me just blow everybody's mind there for a second. I did an activity that you spend most of your day doing as part of my assessment. Is that right? Okay, craziness here. All right, yeah. All right.
And that definitely, and no one's ever, I know how you pressed in here. No one's ever done that either, which now that you did do that and did them at the same time, I do see that there is a bit of retention in there. Yeah. I think just because my wrists are so small, when you look at them, they look normal.
Yeah, exactly. So what we did there was basically a compressive test over the median nerve for anybody who's watching, and we just did it bilaterally so you could feel the difference, number one, and then number two, reproduction of symptoms for the patient. Again, if any of those other practitioners had done this, they would have been able to isolate another potential area that they could have worked on rather than the simple focus of the back or wherever else we're going with brain scans and things like that. Yeah. Okay, what else did you notice about the last visit?
Well, I'm trying to think.
Posture.
There was a big observation that we made there.
Well, I think just every time I see a chiropractor or physio or whatever, they just they don't look at me when I walk in properly, they just look at me when I'm sitting there, and obviously I'm somewhat fixing a posture because I am with a chiropractor.
Exactly, and but that's huge, but you admit that as a patient, and we should know that as physicians and doctors and therapists out there, that what's going to happen. Oh yeah, this is how I normally sit. What are you talking about, right? And then you could feel what I asked you to do. I said, hey, just go ahead, just relax your back a little bit, and then you can see, even right now, you're up a little bit, right? You can see if
She's on TV.
Yeah, exactly, right?
But I think the one thing that you did notice was, I could tell after you said that you definitely were paying attention to it before anyone else was.
Yeah, for sure. Yeah, we had a class of numerous doctors and therapists in there, so everybody could see what was going on.
And then as soon as you mentioned it, everyone was like, oh, wow.
Yeah. And again, just back to basics on our assessment. History, inspection. Don't just observe, inspect. So if we can, we're just going to have her sit here, and we'll have you just sit facing the camera just a little bit more like that. So looking from the anterior view, it doesn't look like that's too much is off right here, right? You can't really see too much, but if she spins to the side, and I'll have you just spin so your back is to me here. And she's kind of cheating a little bit right now too, but she's, yeah, but exactly, because you can see this is what most people will do when they're standing. They'll let their shoulders roll into the front like this. I wouldn't get that unless I did make her feel comfortable enough to go into a more natural position. Most therapists and doctors are just going to, hey, can you turn to the side? Can you turn to the side? No. Make your patient comfortable. Make sure you can see this. And while you're here, why don't we go ahead and have you just lift your arms up and bring them back and around if you can. Like that. And you even watch the way that her shoulder moves. She can bring it back here a little bit, but it doesn't come nice and open back all the way through like that, right? Like in fact, if you look, her whole body twists to the side as opposed to just bringing this shoulder back and then bringing her arm back down. What if we even take your shoulders up and roll them back like that? And see, it's better than it was. Actually, have you been doing stretching and stuff like that with these or not?
Nope.
No? All right. Well, the first time that she came in, when she first did it, it looked like her shoulders could barely move back at all, and then they just dropped straight back down. So it's quite a bit better than we saw before. The biggest thing for her, for opening up her shoulders here, because she's exhibiting thoracic outlet syndrome type symptoms, well, the biggest thing for her is getting her shoulders to be back in a more neutral position and then getting better firing through her middle back to maintain that position and changing her nervous system a little bit to recognize this as her normal standing posture, just like that. All right, so we'll go ahead and have
She was very weird.
but yeah, exactly. So make that comment. How easy to change these things around? We're trying to change it. It's not very easy at all, right? So how often do you work out?
Right now not very good, but I do notice that's another thing. When I do run on a treadmill, I do get really bad pain in here.
Yeah, okay. When you run on a treadmill, I suspect as you get more and more fatigued, you start to roll into your shoulders a little bit more too, right? Yeah. So that would be another example there. Even in her regular workouts that she's going to keep on doing, she's really going to focus on pulling those shoulders back and together and keeping her shoulders back in that position. But the movement was way better there.
That's good.
Yeah, the other interesting thing about her, though, and it has to do with the lightheadedness she has, is we know that if you're looking at, this will seem like it's random, but let me get through it. If you look at jet fighter pilots, what makes the best jet fighter pilot? It's usually a small, muscular person makes the best fighter pilot. The further the distance is from your heart up to your head, the more your heart has to squeeze to get blood all the way up there. And if you look at her, if you look at her neck right here, she has, for her height, she has a very long neck moving up and down. And it's even more than that. If I can, I'll get you to follow the actions that I do, but we'll have you facing forward. And I'm just going to have you lean all the way to one side. So look at how far she can lean. She can get almost to 90 degrees in her neck for lateral flexion, and then we'll go ahead and get you the opposite direction. And the same kind of thing.
This one's almost more, it feels like it's more stretched.
Yeah, exactly. But it's a good variation for us to see on our overall spectrum of anatomical variation. And what if we have you turn your head to the side? Yep. Again, she's past 90. She's at about 100 degrees of rotation this way and then spinning the opposite direction. A little bit restricted that way compared to the other side, but just, again, a little bit past 90. And then if I can, I'll have you bring your head all the way up. And again, big extension all the way through and then coming down into flexion. Yeah. All right. So if you look at her motions, I just got to stress it again. Do the lateral flexion again for us. Like this is the big one.
Back?
I know. Just sorry. Just leaning your head to the side like this. So she leans to the side. Huge movement right there. Right. Okay. So of course, we know each other well enough. You can joke around a little bit. You can say it's a neck like a giraffe. It's really, of course, it's not that long. But when you're seeing her move, the distance she has from her heart, which would be right about here, up to her head, is a longer distance. So this means she may be more susceptible to changes in blood pressure, which would correlate to why she would be fainting a little bit more, or at least be one of the causative factors for it. The anemia and lack of oxygen can also be part of it, but that would be something I would look at as well.
Okay.
So we'll go down this hip nurse protocol again. So we went through history, inspection. You can see some variation in posture, some anatomical variation in the shape of her body. And the other thing was just basic palpation, history, inspection, palpation. So I'm just going to do a hands-on assessment and pushing into these areas. This side is, the really tight scalenes all the way through here, but if we come to the other side, I can push into there, and the last time we did this, it induced symptoms for you, right?
Yeah, I can feel it down my arm now.
Yeah, exactly. And all I'm doing is pushing with my middle finger right over top of her brachial plexus, which is the nerves that supply this region of the upper extremity.
Especially when did you turn my neck?
I did.
That?
Yeah. Okay.
That one was the worst one.
All right. So now we're really going to get into it. So the other test we did, Teresa, have you just spin that way, just a little, the other way, like that. Yeah, just like this a little bit. The other test that we did, of course, we did on the other side, but the other test we did was a simple brachial stretch test where I brought her arm up and back like this. And how's that?
Yeah, I can still feel it a bit.
Yeah, you can feel it a little bit. And then if we add the lateral flexion of your neck, how do you feel now?
Yeah.
You feel it more?
Yes.
Yeah, exactly. And this, again, would be a simple confirmatory test that you could do in practice that's showing you nerve root tension and other areas to evaluate. Again, nobody palpated up here into this region right here.
Nope.
Okay?
They just felt a little bit, did a few cracks, and said, okay, you're good to go.
Yes. All right. So I'm just going to kind of leave it at that. So the question is, would a physio or chiro be a good choice for this? Either one would be a good choice, but they have to recognize where is the pathology coming from. If everybody is just cracking your back right here, obviously that's not changing things for you, right? So we have to look somewhere else. The way that I try and teach, the way that I write about is doing those basic, well, sorry, I shouldn't say that. What seems like a basic assessment for me when I'm describing it for people, obviously is not a basic assessment that's being done out there.
Identified.
Yeah, exactly, right?
Yeah.
So if you're doing your own assessments out there, and this is a good one for our future doctor right here, you make sure and you evaluate anywhere that could be involved in this kinetic chain. If all I did was look at the spine, I missed the major part of this picture right here, right? If all I did was crack and a little bit of muscle work, I've missed the major part of this picture. I've got to give her proprioceptive rehab training to get her shoulders back so she can function and work. Like, let's be serious. How old are you?
22.
She's 22 years old and she's got these symptoms already, right? I want to see her healthy for a long period throughout her life. This foundational work that we're doing right now is going to help facilitate that later on for her, right? And that's what you need to work towards. Yeah. Okay. And as far as the recommendations would be, postural retraining number 1, working into finding flexibility in those areas number 2, and identification of whether she's dehydrated or anything else that could predispose to the fainting that she's having as well. But I mean, it's pretty obvious, right? If I push here and I reproduce numbness and tingling, or if I push onto the wrist and I reproduce numbness and tingling, we have pretty good ideas where the pathologies are. It's a major disappointment for me that no other practitioner has done that, and you've seen dozens, obviously.
Yeah.
Okay, and that would seem like a basic functional assessment, right? But it's going to be baby steps, right?
Yeah,
We got to figure out,
for
we
sure.
can work with this, we can work with this. We've got some obvious symptoms now that we can go ahead and address and work our way around that. And then as you knock these things off the list, things get better and better all the way through there for you,
for
right?
sure.
And that's the goal.
Hopefully.
Therese, thank you very much for your time, for coming
Thank
in.
you again.
Okay, good stuff.